Hello, welcome to Addicted to Murder. This is our new segment, hopefully, that we are going to call our video spotlights.
Woohoo!
So, I'm Courtney, licensed professional counselor with more than 10 years of experience.
And I'm Tricia, and I am just learning how to use this big bright light thing around the camera that we're doing right now.
Yes, it's new for both of us.
We're both kind of a little bit camera shy, so I'm not a selfie person.
I'm not really either.
Yeah,
but
we don't do a whole lot, but it's probably because we're overcritical.
Yes,
Mhm.
yeah, definitely. So we have been thinking that we talk a lot about different diagnoses, different types of things that people encounter in our episodes about our serial killers, but we thought it might be helpful to take some of those concepts and go a little bit more in depth about them and how they might apply to kind of real world situations.
Right. So, so far we've gone over a lot of narcissists.
Yes.
Right. And unfortunately, we were just saying that we don't really know anyone who's a self-aware narcissist, but if anyone out there that is and would like to interact with us and let us know if, just it would be great to hear from you. Courtney, narcissists don't typically end up in therapy, right? Because they don't think anything's wrong.
Right, exactly. Or they don't want to admit that things are wrong,
Right.
So they generally avoid therapy.
There are a few narcissists, self-aware ones on TikTok that I follow, and it's fascinating, and they really break down, what they're doing and how they're trying to change their behavior. So there are places to find that. But today we're going to talk about borderline personality disorder because Charles Cullen has borderline personality disorder, and so do I. So I was diagnosed in 2019 with borderline personality disorder. And, I had really only seen the movie Girl Interrupted, and it's a really weird name. Like, what does that mean? Like Winona Ryder is like borderline between what and what? I kind of think it's a misnamed diagnosis. But anyways, Courtney, why don't you go over a little bit, about it?
Yeah. So just sort of a recap, we went over this in our episode, but borderline personality disorder is a clear pattern of behavior that includes things like intense mood swings, anger, instability in sense of self, so not really knowing who you are, instability in relationships, going between love and hate kind of a thing. It often involves really intense feelings of self-hatred and often involves self-harm or frequent suicide attempts. And so kind of answering your question though, or your comment about borderline between what and what, really what it means is with borderline personality, people tend to go between extremes. So they're, I love you, I hate you, you're the best, you're the worst. There's actually kind of one of the seminal books written about BPD is called I Hate You, Don't Leave Me. And I think that's kind of sums it up pretty well.
Yeah, so I, just thought that I'm a quiet borderline. I keep it inside. When I have told people that I'm actually a borderline, they usually don't believe me at first because from the stigma, it's like a lot of manipulation, like you said, suicidality, stuff like that. And some of that was occurring on the inside, but I didn't act out very often. But it took years of therapy for me to realize that the way that I process things and react to things isn't normal. And it's a lot of emotion. It's a constant up and down. When I get angry, it scares myself. I've scared my partner. I'm not going to go into it, but right now, but it's a real thing. There's like a checklist, I think, and you have to have 9 or 5 of the 9 criteria to meet borderline, and I meet, I think, 8. So I've never been a suicidal person. I've never really been depressed. I don't know if borderline and depression goes hand in hand.
Absolutely.
Okay.
Can.
So I guess I was lucky that I don't have that. I have a friend who's diagnosed with borderline and has bipolar, and I know she has a really hard time regulating her emotions.
That would be a really complicated
yeah. And
situation.
Yeah. And, it took her a long time to get depressed as well because diagnosed as well, because a lot of times I feel like borderlines are misdiagnosed. At least that's what I've read.
Right. Yeah. A lot of times it does take a long time to get the correct diagnosis. And part of that is because there's so much stigma about it that even therapists are sometimes hesitant to give that diagnosis. Because they don't necessarily want their patients to be like labeled or denied access to services or things like that because of it.
Well, and when I Google and go into like Quora or Reddit, it's pretty much all terrible things when people are talking about borderline partners or anything like that. Like, I can't. I mean, some of it I'm like, well, that's fair, but then a lot of it I'm like, okay, you know what? Just like with any mental illness, you do still have responsibility of your actions, regardless of your internal motivations. So just because someone has borderline doesn't mean they're going to do bad things.
Absolutely. Yeah. Most people with borderline personality disorder aren't dangerous. They're not violent. They're just existing in your life, and you probably know someone.
Yeah. I'm trying to think of because now that we're on the spot right here and we didn't script this like we usually do, just certain ways that it affects my life. And some of the things that come to mind are really silly, but say I text someone, my best friend, my mom, my aunt, whatever, and I don't get a response in what I consider a reasonable amount of time, my first instinct is they hate me. What did I do? Or they're dead. I go to all these total worst case scenarios. I overthink everything to the point that I kind of go a little crazy, and then I will overdo it, like with Charlie Cullen. Like, she's not responding, she must need me, blah 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 blah. I will sometimes find myself, I'm learning to stop myself, but sometimes find myself just calling over and over, are you okay, are you mad at me, what did I do? And it's taken therapy and some behavioral modification techniques to make me realize, okay, let's not think about this from our emotional self. Let's think about this from our, rational self. And maybe this person's phone's off. Maybe this person's busy. Why would they be mad at you? What would you could have possibly done? And so just rethinking like that is hard, but it's helpful.
Right. Yeah. I know one of the things that we talked about with Charlie Cullen was in his relationships having that idealization versus devaluations phases. And I know that's something that you told me you've experienced before.
And I thought that was normal. When you meet someone, immediately you're imagining marrying them and having their babies and doing blah, blah, blah. Or even if it's like a friend, oh my God, she or he's the coolest person in the world. They're going to be my best friend. And within an hour or two, you are imagining these scenarios where they are now the center of your world and that's where they belong. And you think that it's crazy. And then on the other hand, though, when they do upset you, it is weird how easy it is to just, they are dead to me. It's bizarre. I feel like it's a defense mechanism as a way to not be hurt. But I have had people very confused in my life as how can you just drop me like that when there was an imagined wrong. But it's weird. It's gone. They never existed. I'm not gonna cry. I don't care. They're just gone.
Right, and that comes and ties back to one of the main features of BPD is this fear of abandonment. And so sometimes it can be I'm gonna abandon you before you can abandon me. Yes,
definitely to avoid hurt. Because when I have felt abandoned, it's usually, luckily, it's usually only a couple hours to a couple days, but the agony that it feels like, and most of the time it's an imagined abandonment. It's nothing. But I'm just glad that these walls couldn't talk, with some of the things that I've put myself through. But, I got to the point, I'm 39, I'm almost 40. And when I went to therapy as a child, I did have childhood trauma. This is typically where this stems from.
Yep.
And my parents, when I was younger, weren't quite sure what was wrong with me because they had no idea what was going on. This was outside the home. But anyhow, they, brought me to a therapist, or I think it was a psychiatrist, because right off the bat, we had one 20-minute discussion, and she gave me Zoloft or Effexor. It was like, you're sad. There you go. And that was it. And that doesn't work with a 15-year-old kid.
And you cannot cure borderline personality disorder with medication.
Right. And they didn't diagnose me because you can't diagnose them until they're like 18, right?
Right. Officially for a personality disorder, you're supposed to wait till they're 18 because your personality is still developing.
And that was one thing that I was telling Courtney before this. I get a little confused between the personality disorders, like the cluster Bs, and some of the other things, because one of the things I've read about borderline is that I really might not have my own personality. I definitely do take on traits that I think that you want to see in me, or, like I will constantly be changing my hobbies, my goals, my jobs, or whatever, based on what I think the person who's so important in my life is expecting of me. And so anyhow, I don't know if that has something to do with me or borderlines in general kind of lacking a core personality. Can you go over that a little bit?
Yeah, so essentially borderline personality comes from kind of having an unpredictable and kind of chaotic environment as a child, in addition to other types of trauma. And so as a coping mechanism, kids learn to put on different faces and different hats. Like, okay, so if I don't want my mom to treat me this way, then I have to be like this. And if, I want this person to like me, I have to be like this. And so that's sort of how they learn to survive in the world, is by being whoever someone else wants them to be.
And I bet, now that you're saying that also by being what someone else wants me to be, they're not going to abandon me.
Right.
Because I'm going to be their ideal.
Exactly.
Yeah.
Yep.
So when I got to be like 36, 37, I was just in a bad place. I was, like I said, I've never been suicidal, but I was just kind of like, what does it all mean? I felt like I was going through a midlife crisis. I was unhappy. I went to therapy. I tried it again. I went to my first therapist. This was before I was diagnosed. And she was like, you have PTSD. And she was like, you need to find a therapist who can do what's called EMDR therapy to help you with PTSD. Didn't know what that meant, but she basically was like, I can't do any more for you. You're beyond my help. Okay. So I did find a therapist. I'm lucky that specializes in EMDR. And what does it stand for? Do you remember? Courtney doesn't do it, but no. She might someday.
Yeah, it's eye movement desensitization
reaction.
I don't remember.
Basically,
I know what it is.
Sorry. She doesn't practice it, but you did say you were interested in learning and maybe doing it someday. Basically, what my therapist does is the concept or whatever is like using two sides of the brain, right? Can you explain it better than me?
Yeah. Yeah. So the idea is there's been some research that shows that processing memories while doing sort of bilateral movement. So in this particular case, moving your eyes back and forth, kind of following like a target or a light or something like that.
For me, it's her finger.
Right. It allows, again, sort of like you were saying, both sides of the brain to be working in tandem. And for some reason, this allows your brain to sort of separate kind of the emotion from the memory a little bit, so that you're able to process that memory without being overwhelmed by the emotion.
They're not totally sure why it works. It was developed for vets who were having PTSD from war, but it does work for all kinds of PTSD.
Right.
So when I was assigned to this therapist and I told her that was what was recommended for me from my last therapist, we did some testing. Now, I was so dissociative at the beginning. Which basically meant I couldn't concentrate. I couldn't stay present enough to do the EMDR. So it took me a year, and we learned that dissociation can also come from avoiding unpleasant thoughts, unpleasant triggers, unpleasant emotions.
Right.
You just check out. And I check out a lot. I have trouble remembering, what's real and what's a dream. I can't always figure that kind of stuff out. And I have terrible memory in my childhood. I just can't remember. It's kind of just gone. It's like, but anyhow, we had to work for about a year on mindfulness exercises. You want to tell them what those are?
Yeah, so mindfulness is a practice of trying to focus solely on one thing in the moment. So that is recognizing what is happening in your thoughts, what's happening in your emotions, what's happening, with the sensations in your body, and really just being fully whole and present in the right here and right now with whatever you're doing.
And it's hard. I mean, for me.
Yeah. It's hard for most people.
Like my first therapist worked on me with it too. And she gave me all these stickers and she's like, put these stickers all over the place. And every time you see one of those stickers, just remember where you are and just ground yourself and don't go all over the place. And visualization exercises, all sorts of stuff that's real boring to me and hard to do because that's sitting still. That's like yoga stuff. But anyhow, I did it and I had to do it because I had to get to the point where I could focus enough on a trigger memory to do the EMDR and sit there long enough to, do the process and everything. And I got there. And it took, like I said, about a year of bringing my dissociation from block to still a little bit, but not so bad.
Reprocessing, that's what the R stands for.
Reprocessing, yes. I knew you'd find it.
Movement, desensitization, and reprocessing.
I should know, but I can't remember these acronyms. It's too many.
Yes.
But anyhow, so I've been doing that for a couple years. A lot of times I'll go to therapy and I don't have anything to talk about today. It's going to be like a waste and then I'll get in there and it's just like word vomit. So I definitely recommend therapy for everybody. Regardless of anything, because sometimes it's just nice to have someone there who's completely not part of your life in any other fashion and they're paid to listen to you.
Yep.
I don't know. It's just really nice to unload it and then to get, maybe some constructive feedback on how to handle certain situations. I've already gone off the point. EMDR seems to have been working for me. We've gone over several of my childhood triggers. And it took weeks for them. We did one at a time and we do over and over again. And basically by the end of the trigger treatment, you're supposed to, when you think of it, not respond in the same way. You're supposed to be like, okay, this has happened to me, but it's not happening to me now. And it's not going to hurt me now. So anyhow, that is one way that I have helped with my BPD. I don't know that that's a common thing with BPD, but it helped me. Also, just knowing that I have it and just knowing that I have it has helped me, because then I can really realize, okay, this is not how I should be feeling. Let's figure out how I should be feeling.
Right, and that's something that I hear a lot from people who eventually do get that diagnosis of BPD is finally something explains the way that I have been existing, essentially.
Right. And it also makes me feel hopeful because life doesn't have to be as hard as I've been making it.
Right.
Because it's me that's making it this hard. These people that hurt me in the past are no longer around, so it's...
Yeah, and I think one thing that I think leads to some of the stigma with personality disorders in general is that it seems like, or it is a fact that you're probably always going to have it.
Mm-hmm.
You know, you don't, like I said, you can't treat your way out of a personality disorder, but it is treatable in terms of learning to manage it and manage the negative behaviors and the negative symptoms that really cause problems in your life.
My boyfriend has had sessions with my therapist to protect himself, because once we figured out what was going on, you know, he's been affected by my BPD more than anyone but myself, because we've been together for about 18, 19 years, and he's just, I was a little bit crazy, but now he knows when he needs to tell me no, for one thing, like, do not drag me into your bullshit. This is not real. What's happening right now? Step back. Don't attack me, because, you know, I blame him for a lot of things. Just basically him also knowing what's going on helps him to be more thoughtful of what I'm going through, but also will put his foot down when I'm being, because I regress to a child sometimes. And so he'll put his foot down and be like, stop. And sometimes I need that, like, mental slap in the face to be like, oh, you're right. So
right, yeah. And it can also help him not take things so personally.
Right.
Like, it's not really so much about what he's actually doing. It's about just a feeling that you're having. And so you and your emotional self might say things that rational self does not believe.
Right. So basically we were sort of inclined to start doing this video stuff because these cases were going. Some of them hit home. You know, personally, I myself suffer from, like I said, borderline personality disorder, OCD, general anxiety disorder, and I have PTSD. So it's, you know, luckily I didn't become a violent person, but it's unfortunately, like I said, I was 38 before I got help and properly diagnosed. So we really want our message to, you know, it's okay if you're if shit happens to you, you know, but it's up to you to go get help.
Right. But help is there. It's out there. And it is possible to not be so impacted by the things that have happened to you.
Yeah, life doesn't have to be so shitty.
Nope.
I mean, it's hard work. I'm probably going to be in therapy for my whole life, or at least a good chunk more. I don't know how excited my therapist is about that, but she's younger than me, so I think
she's got some energy.
Yeah. So anyways, you want to say anything before we wrap it up for today?
I think I just want to say, really, like, Tricia, thank you for being brave and being open and willing to share this with everybody. You know, sharing our stories can be, I think, so helpful to other people who are maybe out there and wondering, like, what is going on in my brain? Or, you know, my therapist said I have BPD, but then I go online and everything about it is horrible.
It is. Don't even look it up.
Yeah. It's true. So thank you for being so open and willing to share that.
Well, I also want to thank Cortney because we work together, and sometimes she's like my therapist at work, even though she's not my therapist at work. So she helps validate me, and I like that.
I think, was I even the one who first gave you the borderline checklist?
I don't know.
I feel like that, I know I did.
Yeah.
But I don't know if your therapist had already talked about it.
Well, when I had talked to my therapist about borderline, she said she was hesitant to give me the diagnosis because of stigma, exactly like you said. So she probably had it in her mind prior to me coming forward to her to be like, you know, because when I was diagnosed with PTSD and dissociative disorders, I was Googling that and it just kept going to borderline. So, yeah. Anyways, it took a while, but it makes sense. It fits. I'm working on it. I'm doing the steps. There are DBT groups out there, especially designed for borderline personality.
Yeah. I think that's a whole nother video that we can do about DBT.
Right, and I haven't done one besides an online one, which, but now that COVID's receding a little bit, hopefully there'll be some more DBT groups. She's run them.
I have run them before. Yep. So I'm familiar with DBT, and
I asked to be in her group, but she thought that would be too weird because we work together. So that's
ethics and things.
That's fair. I overshare. I tend to overshare. So, all right. Well, anyways, I hope that you enjoyed this, and we will be trying to do these along with the cases we're covering.
Right. So it might not be every week or every case, but as things come up, we will be making more of these, I hope.
Yeah.
Please let us know what you think in the, comments, or, shoot us an email. If you have ideas for things you want us to maybe go a little more in depth on, we're open to that as well.
Yay. All right. Thanks, y'all.
Bye.
Bye.